I remember when I was kid in primary school, we used to have doctors and nurses coming to visit us and giving us shots, vaccination. I was really surprised and I asked my teachers, why are we getting vaccinated? And they said, it's to prevent you from getting sick. Came back home, asking a lot of questions to my mom, trying to understand why are we getting vaccinated. And my mom was always smiling. I can see that she was having a happy face anytime we talk about vaccination. Because she said, kid, son, you will be able to go to school and also you will be able to be a doctor later on. So when I was in a medical school, I really focused on vaccine prevention. And then I learned that vaccine works. And that struck me because I remember days ago, years ago, when I was going to church on Sunday, I used to see a lot of people sitting on wheelchairs, not able to work because they said to have, here that they have polio, a virus, who invalidated them, stopping them from going to school, stopping them from working, and they have to beg to have their money. And I felt sad, and I decided to really that motivates me to become a real doctor and to work on immunization. And then later on, I discovered that despite the fact that vaccines work, um, vaccination saves lives. So having that the vaccines, we need a program to get children and people vaccinated. That how I come to know that the expanded program of immunization were created in all the countries to make sure that children get the vaccines, these life-saving vaccines. And that was a critical role of policies. How policies are really having a big impact for us to have vaccination. So we have initiatives that are work in the past, like the Global Polio Eradication Initiative, a set of policies to support countries to eradicate polio. And it works because today we're happy to see that because of those policies and the program and the mass campaign, we were able to eradicate polio in Africa. And today the world is facing another virus, the coronavirus. And scientists made a lot of efforts days and night to develop vaccines. Now we have vaccines that are working. And we also have technicians like us, doctors, nurses, ready to really give the shots. But what we need now, we really need policies to support the initiative like the COVAX initiative led by Gavi and WHO. And these initiatives, we need decision makers, leaders in our country to get inspired by what happened to what they've done before with supporting the expanded program of immunization with clear policies, clear directive to get people vaccinated. And today, more than ever, the coronavirus is killing. And we must stop that. So today I'm talking to you, asking you to really use your decision power to develop policies in each country to support the Ministry of Health, to support the rollout of vaccines, to support the distribution of vaccines by working on legislations, working on regulations to help the vaccine be accessible, but also to make sure that the most in need are getting the COVID vaccines, that the COVID vaccine is distributed in an equitable way so that we reach really those in need. And that can be achieved with clear policies, clear regulation to guide technicians working days and night in each Ministry of Health in each country of the world. We must do it now. We must have clear policies now to support all the efforts made by scientists, made by Ministry of Health in each country to stop the transmission of the COVID-19. It's time to act. Let us work on policies. We know how to do that. Thank you.